During the next hour, you will experience what it might be like to live in a low-income family trying to survive from month to month. The goal of this experience is to sensitize us to the day-to-day realities of life faced by people with low incomes and to motivate us to become involved in activities that help reduce poverty in West Virginia and beyond. When you entered, you were given a family unit. In that packet is all the information you will need. It contains a family description with individual members.
Poverty is not a game, especially for the over 37.2 million Americans who are in poverty.
I am Ann Aber, or Aber, and I'm a mother of 3 children, and I make $9 an hour, and I work 40 hours a week and have lots of bills to pay. Albert is my husband, who's 42. He just got laid off of his full-time job and is no longer collecting unemployment. This is my daughter Alice, who is 16 and pregnant with her boyfriend. I have 2 sons, one 10 and one 8, and I'm trying to get my 10-year-old to get a job because we need the money.
Honestly, the power of knowledge the whole way, getting to figure out from the beginning, man, I wish I would have known that earlier so that I didn't spend the first 2 weeks of the simulation figuring stuff out that I could have already been doing earlier on. And I think that was probably the most prolific thing that really stuck with me was, man, if only I would have known that earlier.
Who neglected their children?
I didn't feed my kids the first week, so they kind of just had to figure it out. The second week, once I got everything figured out, one of the first things I did was get some food for them.
It's just the thought of everybody coming together from different professions, different walks of life, and getting to do this together, that whole IPE part of all this, really changed the dynamic that I'm sure if I would have just been doing it with my dental classmates, that we hang out together all day, we're in classes 9 hours a day together.
It was extremely overwhelming, stressful. I felt frantic, and I felt like I was being mean to people. I was pushing, I was shoving, I was yelling, and yeah, it just really opened my eyes, and I feel like I got a new perspective on something I'd never experienced before.
It felt like my hands were tied for most of it. It felt like I just did what I felt I needed to do.
You have to think about how other things in life, just like the day-to-day to get by, is sometimes more important than the health of, and as a provider, we're you need to pay attention to your health, and it's really easy to preach that, but sometimes it's not always the priority of every patient. And I think with that in mind, you should just be careful with your education and the tone and the judgment that you use based off of that. As
a future dentist, I'm going to have plenty of patients that likely, dentistry is expensive for everybody. It's expensive for us to get through school. It's expensive for us to buy things like tools are hundreds of thousands of dollars sometimes. And then of course that cost comes down to the people that have to pay for our services. We're not just healthcare providers, we're also fellow humans that are going to have to work to try and improve other people's lives.